Hi all, welcome back to my channel. This is Geetu Chandra and you're watching Geetu Chandra Vlogs. Dream, dream, dream. Dreams transforms into thoughts and thoughts result into action. This is a famous quote by APJ Abdul Kalam. So I love this quote because this is really inspirational. So have a good dream that will help you to pursue your desired places. Okay. So let's look into the today's video. In today's video, I'll be discussing you with the listening part A because most of you recommended the most tips and strategies that will help you to achieve a score in listening part. So I'm going to plan that video today. In this video, we'll give you an overall view of listening, what is listening part A, and what are the strategies you need to apply for that, how to approach a listening part. So that will be discussed in this video, and what are all the main tips that you can use when you approach the listening part. So how you can mold yourself to get a good score in listening. So don't miss this video. This is very valuable and this is very precious. If you miss it, you're gonna lose your marks. If you don't want to lose that, please watch the video for more details. So let's move on to the video. Now we are going to discuss about the overview of listening part A. How the listening part A will be presented. So for your understanding, I'm giving you this knowledge. Understand that there will be 2 extracts. Total 24 questions will be there. For each extracts, you will be having 12 questions each. So total 24. 12 plus 12, 24. So each extract will be of consultations. What is consultations? A consultant will be there. That may be a physiotherapist or a dietitian or an endocrinologist like doctors, and the patients will be there. They will be communicating together. They will be conveying the messages together. They will be asking questions. The consultant will be asking questions and they will be giving answers. So this will be the consultation format. So in that consultation, in that conversation, you're gonna give the answers in the gaps. So you're going to fill the gaps using that extracts. Okay. So this is the way you will get the exam. Out of 24, it is really advisable to get 24 maximum, if not 22 maximum. This is why I'm giving you advice, because if you score a lot more mark in listening part A, you are going to succeed in your listening part, because you just need to complete part B and part C together around 8 marks. How's this? It's really useful, right? So to get a good score, you have to practice effectively and actively in part A. You have to score maximum amount of mark in listening part A. Is there any strategies? Is there any possibilities? Yes, of course, because I do have evidence, because I have practiced and I have gained a good mark in listening. So I can assure you, I can swear that is possible, because you can score a 24 out of 24 in listening part A. How that? So let's listen to the next segment, strategies. So the tip number 1, listen to the key term in the intro part. For example, you hear a physiotherapist talking to a patient called Ray Sands. So what is there in that intro part? There they are mentioning the physiotherapist. So you could expect what all the points will be there in the scenario. Also what you have to answer, what you have to listen for. For example, if the consultation is a physiotherapist, they may ask some kind of injuries, any breaks, or the signs and symptoms, the initial treatments. They may discuss such kind of points. So that things will flash up in your mind. Okay, this is the first tip. Listen to the intro part and you have to listen the main key term in the intro part. This is the first tip. Tip number 2, listen to the subheadings, because in the extract you will be having subheadings in the left side. Okay, you have to listen that subheadings that may be in a chronological order. For example, initially they will mention the clinical symptoms, the medical treatments that have been taken, and sometimes the headings like referrals or review or recommendations. So this may be the order. This I'm giving a suggestion, okay? So you have to listen, mainly listen to this point, because you have to listen the subheadings, so you will understand. It will be in a chronological order, though, so the information will be passed in a systematic way. For example, while listening the extract, you may miss the conversation. You may get lost somewhere else. So what you have to do? So listen to the subheadings. Sometimes they will be discussing about the symptoms. So you forgot that. You didn't get that point over there. So you are lost over here. So what you have to do? Suddenly just go back to the next subheading. So there you will catch the next points. So you are not going to lose all your marks. Okay. This is the way you can utilize the subheadings. If you listen to the subheadings properly, you will understand what is the first and what comes the next. So that if you miss some questions, it is okay. It's not a problem, because you can go to the next part. You will not miss the whole conversation. This is the way you have to utilize the subheadings. So the tip number 2, concentrate on your subheadings. Okay. Next one is the tip number 3. Use the bullet point to understand the steps. For example, each bullet point will convey each message. So concentrate on bullet points. So that will give you an information that this point of topics will be discussed over here. So if you go to the next bullet point, you will be able to understand the next one. So I am giving you clear idea that concentrate on bullet point. Each bullet point give you each answers, like each points they will discuss there in each bullet point. That is the third tip. So let's go on to the fourth tip. What could be the fourth tip? I always compel you to study the synonyms. Even you read, or even you listen, or even you write, always concentrate on synonyms. Synonyms contribute a lot, because what is synonym? So tip number 4 is use synonyms wisely. We have to concentrate on synonyms. In this example, for example, if they are talking about a particular thing, they will talk in a layman's language. So how are you going to understand that? Sometimes they will be talking to the persons in different way, and in the case notes or in the discussion they have given, in the filling the blanks you have given with different wordings. So how are you going to understand? You have to expect, or you have to imagine, or you have to assume what could be the discussion, what could be the word. So you have to imagine that.
Say for instance, listen to the question number 7. Okay, listen to the application of dash provided some relief. So 7th question, you have to fill the gap in the 7th region. So see the application. We have to look for the synonym of application, and here provided some relief, some kind of relief they are getting. So instead of relief they will be saying something else, or instead of application they will be using some other word. So we have to look that both words in the audio extract. So let's see the real conversation in this. See, and I was told to put compression. So put they have used there. Compression packs on the affected area, I mean that did ease. So ease is the another word. So you can see that instead of application they have used the synonym put. Okay, and instead of relief they have applied ease. So these are the both synonyms they have used. So you have to look the conversation in such a way. So altogether our answer is compression packs.
What is tip number 5? So here I am compelling you to concentrate on the parts of speech. If you are unable to understand parts of speech, you may not be able to answer effectively. So you have to listen parts of speech like noun, adjective and verb. Noun, what is noun? Noun is the name of place, person, things or objects or animals in a sentence. So this comes the nouns. For example, table, cot, chair, everything comes under name. So something that is naming a person, place, things or an animal. Okay, that is noun. What is an adjective? So you should understand the difference. Okay, an adjective is the thing that describes or modifies a noun. So that is an adjective. Something that describes or modifies the noun is an adjective. So what could be an example? So I'll give you an example sentence like, they lived in a beautiful house. So what is beautiful? Beautiful is an adjective. To describe the house, they have used the word beautiful. So this is the adjective. So you should understand the difference between the noun and adjective. And what could be the verb? So verb is an action, an occurrence, or what could we say? I'll give you some example. Okay, verb is an action or an occurrence or a state of being. For that, I'll give you an example. For example, like run, jump, think, act, all comes under verb. So these are the verbs. So you will be understanding the major difference between the noun, adjective and the verb. By understanding these parts of speech, you will be able to fill the gaps in a proper way. So you will not lose marks. So you will be getting more marks because you will be having a great idea of parts of speech, so that you will be filling the gaps effectively. So that is the part, tip number 5 or the strategy 5 for your OT listening part A. Alright?
For this, listen to the question, okay? The question option number 1. Back injury sustained lifting dash. So, you are just expect a noun over there, okay? So, in the question number 3, option number 3, listen to that. Pain described as dash. So, here you need to assume an adjective over there, okay? So, let's see the answer. First one is heavy suitcase. That is a noun. So you are expecting when you get a dash over there, you'll be expecting a noun over there, okay? Sustained by lifting a heavy suitcase. That is a noun, okay? Pain described as intense. So the pain is described by some words, that is intense. So in your description or when you listen to the conversation, you'll be looking for such words, okay? This will be helpful if you learn parts of speech that will help you to understand what could be filled in the gaps. So that will contribute a lot to your listening part A. So always listen and improve your skills, and at least have a base on parts of speech. That will help a lot, okay?
Next effective tip is underline and assume. So how are you going to do that? When you get the script, the dash will be there, you have to answer there in the gap. So what you have to do? You have to underline the key point near the dash so that you will be understanding this will be expected. For example, severe pain in dash. So severe pain. You have to underline severe pain. So what is the severe pain? Severe pain in somewhere. Where the location is. So you will be underline and assume. This is the tip. Underline. You will be underlining in the severe pain, and here the assumption is like site. So you have to look for the site. When the patient talks, you need to assume that which site the answer will be. So the answer will be a site. For example, it may be a leg or it may be a joint somewhere else. So look for the sites when they talks. So this is the way. Underline and assume. This is the tip. Alright? If you are unable to follow the instructions, or if you are unable to follow the extracts while you do the listening test, I'll give you a tip, because this is vital one when you practice. Adjust the speed of your video. If you practice the listening test, subtest in the YouTube, there are a lot of videos, so you can practice that. Select accordingly, and if you practice that in the video, there will be 3 dots. In that 3 dot you need to select, and you have to adjust the speed accordingly. If it is in a good speed, you will be able to find the answers little bit difficult once you practice to that. If you practice in a very speed way, you will be able to answer in the exam very effectively, so that you can adjust the speed. So in real scenario, you'll be finding it very easy to understand. So try to do that. That is one more tip. And the other tip, I said you there are a lot of podcasts in the YouTube. So they'll be giving you the script also. try to write down the podcast which is mentioned there in the YouTube. They will talk to each other, or they will they will give you some instructions, or like an audio extract will be there. You have to listen to that, and you have to attach your headset, and then you have to write down what they are talking to each other without missing each word or each sentence. First time you will feel very much difficult, but later on you will improve yourself. Once you get used to that, it will help you to answer the listening part A in a very effective way, because I have experienced that. So you should practice in such a way. When you get free times, 10 or 20 minutes, more than enough. You have to practice. You have to switch on the video of a podcast. You have to listen the audio script, Then you have to write down the script, what they are talking to each other. So you have to write down the conversation. So that will help you to improve your listening part A. I swear you have to get 24 out of 24 or 22 out of 24. That will guide you to get a good score in listening part A. This will improve you, or this will help you to score a better mark in listening part. So this is not so easy, not attained without the effort. Your effort matters. So practice well and put your hard works into it. Surely you'll get your good mark. Okay? Now we are approaching to the final session of this video. So here I'll be discussing you with some of the sources that you can utilize to improve your listening skills. As I have told you many times, you have to always listen to the language that they used to speak. So that will be effective to understand when you go for a listening. So in this video, I'll give you an example of like you have to listen to some of the channels that is there in the YouTube, and you can effectively use to improve your listening skill. So first and foremost, I always recommend to listen 24 hours accident and emergency. So just go to the YouTube and you have to write 24 hours accident and emergency. You will get there. You have to see the videos in that. You will be just selecting. It's like I said you before, it's like an like consultation. One patient will be coming, or it is an emergency situation. The patients will be coming inside and they will be discussing to the with the consultant, and they will be asking about the symptoms, conditions, and the patients will be describing their effects or their difficulties, and they will seek advices from the consultant. They give some advices like medical management, and they'll provide some consultation advices in that scenario. So this will be very much effective to improve your listening part A. So don't miss this one. So if you get an opportunity to listen, or if you get time to improve your listening skill, go to the YouTube channel 24 hours accident and emergency. Then you will get a lot of materials over there, a lot of things to listen. The slang you will understand, the way they speak, that is very effective. So you need to go through that. That is the one thing. And I always says you to understand Virginia Allen's videos. That also will help you to understand the language spoken. Okay. And one more thing, BBC News. This will improve your concentration. First, you won't understand anything at all. You don't even able to follow their instruction. You don't even able to understand also. So what you have to do? First 1 or 2 days or even 1 week, you won't understand. Keep on listening. Keep on listening. I'll assure you that you will be able to understand after 1 week. You will get some of the points in between. Then you will improve yourself and you will understand what they talk about. So this is the way you have to improve. Okay. BBC News, Australian Health Journals, TED Talks, Health Talks. These are the sources, effective use of these sources. Even the podcast in the YouTube also will give you a lot of materials, so you can go through that also. So this is the way you need to improve your listening skills. Always practice 24 hours accident and emergency, so that you will be listening and improving your skills. So dream. Again I'm saying dream. Dreams transforms into your thoughts, and your thoughts result into your actions. Not only the dream, you have to work hard to improve your score. If you want to achieve a great success, you want to work hard for it. One day you will realize the success, the fruitful effect of your hard work. So wish you all good luck. Thank you.